Do you know that one of the faces that I find so attractive are whenever you see in social media that like indigenous woman who's been out in the sun and has so many wrinkles and there's like so much wisdom and history. And I look at that and I'm like, I want to sit and have a conversation with that woman. And then I go to the mirror and look at my own self. And I do have that feeling some days of like the person I'm seeing in the mirror isn't the person I see inside of me. And then I'm always thinking about the society as a whole. And I'm really concerned right now that we have a culture of people that are so resistant to aging because either they don't feel good about themselves or the patriarchal world, the way that it exists right now, has it so that women are considered worthy if they're beautiful, and when they're not beautiful, they're no longer worthy. And maybe we should really be addressing all of that. And so when it comes to skincare, especially some of the more toxic versions of skincare, I get really worried that we as a culture are heading down the wrong path.
I hear you, and I'm a plastic surgeon. Yes, 90% of the people we see in my office are women. And society is not kind to women as they get older.
That's true.
Now, yeah, in an ideal world, we would say, you know what, whether you grow older with the wrinkles or not, it shouldn't matter. There's beauty in everybody. And that's one of the statements that I try to put out there on my social media is that there is beauty in everybody. No matter what size you are, no matter what shape you are, no matter how your skin looks, there is beauty in you. But at the same time, we also live in a society where, we're bombarded with these images, especially with social media, of wrinkle-free, smooth faces. And it's hard not to get caught up in that. Yeah. And I think that, the way I look at aging overall, and I try to encourage this to my patients and my followers, is that it's a gift to get older.
Yes.
It is a privilege to get older. And because when you think about it, who wants the alternative? But at the same time, sometimes it's not so fun to see those changes and feel those changes in your body. And so the way I try to encourage people is think of it as a blessing, because we don't want the alternative. The alternative is you're in the ground. But at the same time, enjoy that process of getting older. And if part of that enjoyment is fighting it every step of the way by enjoying a fun skincare routine, by eating great foods, by going to restaurants that are actually fueling your body with anti-inflammatory, healthy foods and enjoying those meals, then why not? Why not buy that outfit that you feel really good in? We only live once. And so whatever it takes for yourself in general to feel great about yourself, then by all means do that. Where obviously we stop the line is when you're doing harmful things or doctors are promoting harmful things that aren't going to necessarily get you to that point.
Yeah. Oh, that's so well said. So that leaves the question of how do we know if it's harmful or not? So, and before we get into the natural stuff, I want to unpack some of the unnatural stuff. So I'll give you an example, and then this is like full transparency. Yeah. Only the people closest to me know this. I get comments a lot on socials of people asking me why I don't Botox. And I've even had some rude comments. Somebody sent me a message and said, I'm the same age as you, I do Botox, and you look much older than me. And I have a personal value system for my health. And that is that I spent most of my 40s detoxing myself so that I could bring my hormones back into balance. I could get my mind on track. So the last thing I want to do is start to inject myself with a poison that's going to put me back into hormonal dysregulation. And that's my lens. And I always tell people, like, I'm not trying to project my ethos onto you. This is just what I have spent too long trying to detox. And so there's certain things I avoid. So let's start with some of the things we're seeing, like the fillers and the Botox and some of those. How toxic are they? How do we know if that's good or bad for us?
So, first of all, nobody should ever be shamed for not doing a cosmetic procedure. That's it's just not right. It's mean and it's unnecessary. You and I both know we have a lot of friends in the alternative medicine space who are all about clean living, and we know that they're doing Botox and we know that they're doing filler, and sometimes they're doing too much of it.
Yes, thank you.
So let's start with Botox. It's the number one cosmetic treatment in the history, probably of the world. Every year, at least 7 million Americans undergo Botox injections. So Botox is a toxin. It's botulinum toxin, which is a protein that is one of the most powerful toxins in the world. And what it does is when you inject it into the area of muscles, basically skeletal muscles that create basically contractions, that it will actually prevent the nerve impulses to that muscle temporarily. It blocks the transmission of nerve impulses to certain muscles. Now, it was initially used for medical purposes. Somebody, let's say, has an esophageal spasm. You inject Botox into the esophagus, that esophageal muscle, and it relaxes it. And where we started seeing actually the cosmetic results, it was a husband-wife team, a dermatologist and an ophthalmologist in Canada. And the ophthalmologist was injecting Botox around the muscles of the eye to prevent spasming of those eye muscles. And the dermatologist's wife noticed that, geez, in those patients that you're injecting it into the eyelid to prevent spasming of that eyelid, the wrinkles got better. And they started thinking, well, what if we inject the tiniest amount in certain muscles that create wrinkles of facial expression? And those most common muscles are the muscles of the glabella, which are the corrugator muscles, the muscles that create the vertical wrinkles of the frown lines between the eyebrows. There are the forehead horizontal muscles. Those are the frontalis muscles of the forehead. And then the orbicularis oculi, which are the muscles that cause you to crinkle your eyes or squint, and those can create crow's feet. And if you inject Botox into those muscles, it prevents those transmission of nerve impulses for about 3 to 4 months, which will basically soften those wrinkles because those muscles aren't creating them anymore.
Right.
It lasts 3 to 4 months, and then it wears off, and then those muscles typically come back again. So big question is, how harmful is Botox? Now, it's interesting. I had a good friend of mine who's in the alternative medicine space, and she called me one day and she said, look, I had some Botox injections, and not that long afterwards, I started having all these weird neurologic symptoms.
Yeah, I've heard
She
that.
said, I've done some research on it. I can't find anything on it. And this actually was a doctor of natural medicine. And she said, can you ask some of your dermatology colleagues if they've seen it? So I started calling colleagues of mine, people who've been doing this for 20, 30 years, like myself. None of us have had a single definite case where somebody has had true neurologic issues from Botox. And I'll tell you, Mindy, in my office, we've probably treated realistically 20 or 30,000 Botox treatments in the last 20 years, and I've not had a single patient ever have a true severe complication from it. The most that we've ever had that we know of is a little bit of a droopy eyelid when the Botox unfortunately migrates to the eyelid muscle, and that happens for about 3 to 4 months. That being said, you can go down the rabbit hole, and there are Facebook groups of people who do believe they have systemic reactions and neurologic reactions to Botox. It's something that hasn't been, unlike breast implant illness, it doesn't appear to be widespread. I think that anybody can react in any way to any substance that we can't necessarily explain, and that could be a situation there. So in general, I do believe that Botox overall is safe for most people. Obviously, there's always going to be potential outliers, but unlike breast implants, I think those outliers are quite few and far between.
Yeah. Yeah. I mean, because they're both versions of plastic surgery, I could really see the logic behind one is an injection and one lives inside your body. And anything that's inside your body has, and if it goes awry, has the potential to continue to toxify the body. So my brain does slant more like just avoid the toxins. Otherwise, you may have to detox it later.
There was actually an interesting study in rats where they did inject Botox into the facial muscle of rats, and then they sampled their cerebrospinal fluid and did find Botox in the CSF.
Yeah.
But we don't know that we have not seen at all any type of known true manifestation from that type of finding. Like I said, it doesn't mean that people can't, that won't happen. It's just that in our scientific literature, there just hasn't been these types of cases, other than what you hear anecdotally, like I said, online and stuff like that. So yeah, that's what we have.